So I hope all of you guys have visited the various booths outside, and those who are online joining us virtually, we will start our second part of the forum now. So we would like to invite Dr. Sarah Tan, one of the associate consultants with the Department of the Endocrinology, who will be sharing with us the medical options for weight loss. Thank you.
Okay, good morning everyone. I'm Dr. Sarah, one of the endocrinologists from the SGH Obesity Center, and we are really glad to have all of you with us here today. I hope that you are enjoying the session so far. So today my talk will be sharing with you more about weight loss medications, and in particular I hope to dispel some of the very common myths that many people believe about weight loss medications. So I'll go through some of the common myths surrounding these medications, and I will be providing you with some facts and information to bust these myths. Okay, but before we get into that, let me start by giving you an outline on who are suitable candidates to receive these medications. So weight loss medications are indicated in individuals with a BMI of 27 or more, if they have complications of obesity, such as diabetes, sleep apnea, or arthritis, or individuals with a BMI of 30 or more. Another thing to emphasize is that these medications are not indicated in people with a normal BMI. I would also like to emphasize that the purpose of treatment of obesity comes from a medical standpoint, not a cosmetic standpoint, and thus our target is a weight loss of 5 to 15% of your body weight, which has been shown to be medically significant in order to achieve a significant medical benefit. So this means that for someone whose starting weight is 100 kilograms, we would aim for a weight loss of 5 to 15 kilograms down to a target weight of 85 kilograms. Okay, so you've heard a lot about the different weight loss treatment options this morning. So this pyramid is just to give an overview. To show where pharmacotherapy or weight loss medications sit amongst these other treatment options for obesity. So looking at the pyramid, we can see that lifestyle modification sits at the base of the pyramid, and basically this forms the foundation for the treatment of obesity. However, when someone's BMI is higher, we do need to consider more drastic treatment options that are able to produce greater weight loss. But of course, with greater weight loss, these options also come with higher risk and cost, such as surgery. So medications sit somewhere in the middle of the pyramid for those patients who do not quite meet the criteria for surgery, but yet they need a bit more intervention than just lifestyle therapy. Okay, so let me share more about weight loss medications and the myths surrounding them. The first myth is that weight loss medications are not effective. So perhaps you have tried some of these medications in the past, or you may have had family or friends who have tried and were not able to achieve the desired effect. So let me go through some of the common weight loss medications that we use in Singapore, as well as the expected amount of weight loss with each type of medication. So just to take note that these numbers are just to give us a sense of the average weight loss to expect. Of course, the actual amount varies from person to person, with certain individuals who are able to lose more weight and certain individuals losing less weight. And I also like to highlight that all these medications stated here need to be prescribed by a doctor. Weight loss medications or supplements from the internet, like herbal remedies or slimming packages, are not recommended, as they are not likely to be effective and they may even be dangerous. So let me go through these medications one by one. The first medication, Orlistat, is a tablet that needs to be taken 3 times a day. So how this works is that it actually reduces fat absorption in the gut, and it's able to produce about 5 kilograms of weight loss. Secondly, we have phentermine, which acts as an appetite suppressant. So this is a tablet that's taken once a day, and it also provides about 5 to 6 kilograms of weight loss. Next, we have liraglutide, also called Saxenda. So this is an injection that needs to be self-administered on a daily basis, and it works by delaying gastric emptying as well as suppressing appetite. And this medication has another benefit, which is that it also helps to improve diabetes control. It can produce about 8 kilograms of weight loss on average. And then lastly, we have semaglutide, which comes from the same family of medications as liraglutide, and it acts in the same way. It comes under two brands due to two different doses. So currently, only the lower dose formulation is available in Singapore, called Ozempic. Strictly speaking, this is only approved for diabetes treatment in Singapore, although semaglutide is approved for the treatment of obesity without diabetes in other countries such as the US. So the difference between semaglutide and the liraglutide is that semaglutide is a weekly instead of a daily injection. The amount of weight loss is also around the same, 7 to 8 kilograms. For the higher dose of semaglutide, which is called Wegovy, this is not yet available in Singapore, but it's able to produce even more weight loss of about 15 kilograms. Okay, so to summarize this section, we can see that we actually do have quite a few effective weight loss medications available, but these need to be prescribed by a doctor, and you should avoid over-the-counter or online purchases. These medications can result in an average weight loss ranging from about 5 to 15 kilograms, depending on the type of medication used. And some of the medications, liraglutide and semaglutide, also have an added benefit on diabetes control. Okay, so moving on to the second misconception that many people have surrounding weight loss medications. So many believe that once you're on the medication, diet and exercise are no longer important. Okay, this could not be further from the truth. Okay, so why do we still need lifestyle measures when we are already on medications? So firstly, in terms of efficacy and the numbers that I quoted on the previous slides, these statistics describe the weight loss outcomes of medications with lifestyle intervention. And the studies have shown that for patients who tried to be on the medications without making any lifestyle changes, their weight loss was actually much less. Lifestyle measures form the cornerstone of the treatment of obesity, and it's important to build up these long-term good habits that will last even when the medications are stopped. Thirdly, during weight loss, muscle loss also occurs, and thus exercising and eating right are very important ways to maintain our muscle strength. And lastly, control of diet also helps to reduce the risk of side effects of some of the medications. Overeating or binging while on certain medications can actually lead to side effects like nausea and vomiting, which I will go through later on as well. Okay, so diet and exercise are actually paramount and essential for weight loss, even while on medications. And medications actually work synergistically with your lifestyle changes. For example, it helps to reduce your appetite so you're able to comply to your diet plan a bit better. Exercise is also very important to maintain your muscle mass and strength. And these will allow for greater weight loss and greater long-term success. And lastly, overeating while on certain medications can lead to nausea and vomiting. Okay, so speaking of side effects, I'll move on to the next myth, that weight loss medications are dangerous. Okay, so perhaps some of you have seen some of these news reports over the years of weight loss medications that have resulted in fatal consequences. Okay, however, let me emphasize that most of these medications reported here were medications that were sold over the counter or on the internet, and they were not actually approved by the Health Sciences Authority in Singapore. Weight loss supplements sold over the counter or online can be very dangerous. They may contain illegal substances such as illicit drugs or banned substances. And these medications can have deadly side effects. So it is true that unregulated weight loss medications can indeed be very dangerous, and they should be avoided. Okay, how about those approved medications that I mentioned earlier? So rest assured that all obesity medications have to go through rigorous safety testing, and all these drugs have been proven to be safe if they are prescribed by a licensed doctor. But of course, like all medications, they also come with side effects. So let me give some examples of the common side effects that we see with some of these medications. Okay, so for orlistat, as mentioned earlier, this works by reducing the absorption of fat in the gut. And as a result, gastrointestinal side effects may occur, like cramps, diarrhea, and oily stools. Secondly, phentermine. This works by reducing appetite. Some side effects include dry mouth, palpitations, difficulty sleeping, and anxiety. And this medication is not suitable for individuals with uncontrolled high blood pressure, heart disease, or psychiatric illnesses. And lastly, liraglutide and semaglutide work by reducing gastric emptying and suppressing appetite. They can also be associated with gastrointestinal side effects like nausea, vomiting, diarrhea, and constipation. So it's very important for you to be thoroughly evaluated by your doctor before starting on these medications. Certain medications may not be recommended for certain individuals depending on their medical conditions. It's also important to note that all these medications are not safe for use in pregnancy. Okay, so although there are some side effects associated with these medications, we also have some tips on how to reduce these side effects. So firstly, it's important to strictly follow the doses recommended by your doctor, as side effects tend to occur as the dose is increased. So I've had patients in the past who tried to increase the dose of their medications themselves in the hope of losing more weight. This is definitely not recommended and it may be unsafe. Secondly, it's also important to avoid overeating and binging, especially if you are on medications like liraglutide or semaglutide, as this can increase the risk of developing side effects like nausea and vomiting. Do monitor for any troubling symptoms and inform your doctor of any. And lastly, remember to avoid weight loss supplements, which can be dangerous. Okay, so thus, while unregulated weight loss supplements can indeed be dangerous, regulated weight loss medications are overall safe when used under the supervision of your doctor. Okay, and I would like to address the last myth surrounding weight loss medications, that these medications lose their efficacy over time. So in order to address this, let me explain an important concept surrounding weight loss and its phases. When we think about weight loss, many of us imagine a graph that looks like this, with continued and progressive weight loss over time. So for example, many may think that, okay, if I lose 5 kg in the first 3 months, I can expect to lose another 5 kg in the next 3 months, and so forth. Unfortunately, our bodies do not work this way, and in reality, the curve is expected to look a lot more like this, the one in orange. Okay, so the bottom line is that weight loss is not linear. It can be divided into 2 important phases: weight loss and weight maintenance. So we do not expect continued weight loss to occur because there are changes in our body's hormones and metabolism that promote weight regain. And this pattern is seen regardless of what method of weight loss is used, be it lifestyle measures, medications, or even surgery. So with weight loss medications, the initial period of weight loss usually occurs in the first 6 to 12 months after starting the medication. And thereafter, we do not expect your weight to continue to drop indefinitely, but rather we move into the weight maintenance stage. And this does not mean that the medication is not working, because even weight maintenance can be a challenge, and if you are able to achieve this, it is considered successful. So this is an example of the weight loss trend seen with one of the medications that I mentioned earlier, liraglutide. So the weight trend is outlined in the purple line. And as we can see, the main drop in weight is seen in the first 24 weeks, and thereafter the line plateaus as the drug is continued. Okay, so we do not expect continued progressive weight loss with any form of therapy, including weight loss medications, but weight loss medications do provide successful weight loss in the first few months, and thereafter they help to keep the weight down in the weight maintenance phase, which can be equally or even more challenging. So like any other medication, the effects of weight loss medications will be lost if the medication is stopped, and weight regain can occur. Okay, so I've come to the end of my talk, and I hope that this brief overview on the types and role of weight loss medications has been useful for you. We will be addressing questions at the end of the session, so do let me know if you have anything that you'd like to ask. Thank you.
Thank you, Dr. Sarah. Just for some housekeeping, just keep the electronic devices on silent mode. Okay. So next up, we have Dr. Ravi from the Department of Gastroenterology, who will be sharing with us one of the new minimally invasive procedure to help with weight loss. Dr. Ravi.
Good morning, everyone. Thank you for taking your time to come on a weekend to learn more about obesity management. Throughout the morning, we have heard a lot. There was a lot of information that you might have received. If we were to summarize them, first thing, there are different parameters, as some of my colleagues have explained. Waist circumference is an easier way for you to measure how your body is changing over time. And some of the key facts for us to remember is obesity in Singapore is nowhere going down. Obesity is a disease and it is increasing. And it's not just the adults. Many of you here might have noticed that your children, grandchildren are all turning obese, and this pandemic has not made it easy. As Fong Ching mentioned in the initial part, a survey in Singapore during this pandemic shows that 1/3 of the population has gained weight. So the question is, why did we end up in this stage in the last 3 years? Main reason is we have become sedentary. My neighbor, I've not seen him come out of the house for the last 6 months. And then every day what I see is packages and packages of Grab food delivery outside. So I'm yet waiting to see him, how he looks. So this reflects not just our own household, the whole country has been doing this. And what happens when we pile up all this excess weight, we are going to subject ourselves to the risk of all these medical comorbidities, be it diabetes, high blood pressure, arthritis, in females, PCOS, irregular menses, infertility, and so on and on and on. It increases your risk of having 13 different types of cancer. So obesity is a disease that needs to be addressed. There is no reason for us to hide behind the curtain and say, well, next year I will go and seek doctors. Because what happens is most of the time, we procrastinate seeking medical help, and by the time we decide we need to seek help, studies have shown that it's almost 6-7 years we procrastinate and we avoid. That's a pretty long period of time before we seek help. So many of you would have tried this. New Year is coming, Christmas is near, Chinese New Year is coming. After all this time, we are going to look for slimming tea. January, the membership for gym is going to be on the high. And then we are going to look for pills. We are going to look for intermittent fasting. There is going to be CNA episode on intermittent fasting. So we will all try different things. But the end result is sustainability. We won't be able to sustain. And then again, within a month, we will say, hey, I need some more help. Whatever I did is not working. That's when most people come to a clinic for consults. And of course, we would want everybody to seek the best treatment, which is bariatric surgery for those who are obese or even medications. But sometimes in reality, what happens is when we advise all of you to consider the most effective treatment, many of you, that will be the first and last consult in the clinic. You don't return back. At the most, 4 or 5 agree, but the rest go back home, don't come for appointments. And then again, you are in the community trying different things with not much help. The problem when we understand is why we are not able to push you to the effective treatment is there is a perception and fear towards surgery, saying, I don't want permanent change. I want something that is simple. At the same time, I want to lose weight. So the question is, if there is a non-surgical approach, saying I do something just one time that helps me lose weight, and then I'll change my diet and lifestyle to maintain it over the rest of the time, that would be something appealing for most patients. That brings us to this concept. Yes, now in Singapore, for the last few years, we have been having something that meets your demands and requirements. We have treatment options that has no scars in your body. You don't have to stay in hospital for long. The procedure is extremely low risk, and you at the most stay in hospital for 24 hours, and then you recover very fast. You are not going to have much symptoms. All you do is you come get the procedure, you get a rapid recovery, and you go home. And in fact, all these procedures are reversible. There is not going to be any permanent change in your body. So that's a lot more appealing to many of you. Maybe that may help you, in fact. So that brings us to the concept of this new service that has been available in Singapore for the last few years. We call it as bariatric endoscopy, where your recovery is very fast. Your hospitalization is pretty short, as we detail. So what are the things? There were a lot of questions during breakout session asking how does this balloon work? Will the balloon burst? What type of balloon you put in? Of course, there are many different types of balloons, but all balloons work the same way and all balloons are safe. How it works is we fill the balloon. There are balloons which are done by endoscopic approach. There are balloons which are done by swallowable approach without endoscopy. So what we do is we first check your stomach, make sure your stomach is okay. If your stomach is fine, then we place this balloon. How it is done, we first do an endoscopy, assess. At the same time, we put this balloon, we fill it with liquid. The liquid is typically blue in color, like how Eugene mentioned. This is for us to understand whether the balloon is intact, whether the balloon is leaking, or what happens to your balloon. This is how it looks like in real life. How long does it take for us to put this balloon in your stomach? At most is 5 minutes. Do I have to come to stay in hospital? No. You come, you will be sedated, you will be sleeping. We will check your stomach for any major problems. If your stomach looks healthy, we put the balloon in. 5 minutes, then you go home after monitoring for a few hours, and we will give you some medications to overcome some of the intolerance episode in the initial phase. So what to expect after balloon? In the initial phase, yes, there is an adjustment period between your balloon and the stomach. You may have some discomfort, vomiting episodes, reflux symptoms, but medications help you to tide over those problems. Once your stomach gets adjusted, life is free and easy. Next is you have to follow all the advices which our colleagues give you in terms of diet and activity. You follow that, and on average, this is the weight loss that we are going to see. Is the procedure very safe? The procedure is safe. Are there instances of major complications? It's very, very, very low. It's like you guys going for endoscopy to check your stomach, colonoscopy to check your bottom. The risk with these procedures is same as risk with having a balloon. So you don't really have to panic so much, oh, is balloon very risky? Not at all. What happens? Most of the balloons, as I said, different brands stay in the stomach for different durations. The longest duration a balloon can stay is for an year. At the end of 1 year, once you achieve your goal, we repeat another endoscopy and then pull out the balloon. Again, the process of taking out the balloon is 5 to 10 minutes. Doesn't require you to stay in hospital. You come, get the balloon removed, you go home. Subsequently, after balloon removal, like Sarah has mentioned, everything revolves around changing your diet and lifestyle intervention. You have to adhere to the fundamental tenets of weight loss. If we deviate from that plan, of course, yes, we are going to have a weight regain. So whatever you achieve during this period, it is important for you to maintain during rest of your life by changing your lifestyle. That forms the fundamental aspect. So second options for those patients who say, well, I don't want something sticking in my stomach requiring 2 endoscopic procedures. Then you have alternative options. These options are again non-surgical approaches. We call it as endoscopic sleeve. How it works is we put in an endoscope, we go through your mouth. These procedures are done under anesthesia. So once we reach the stomach, we evaluate your stomach to see if your stomach is healthy. Then we identify the suitable area in your stomach where we want to reduce your stomach by stitching. But this process does not involve cutting your stomach. So the device has specialized stitching apparatus attached to it at the tip, and using that stitching apparatus, we place multiple such stitches in the stomach. As you can see here, these stitches reduce the size of your stomach, and basically what happens is once we make your stomach smaller, the amount of food you start to consume becomes lesser. You feel full all the time. You're not going to have a big meal portion after this procedure. And coupled with regular activity and exercise, you're going to lose weight. So in real life, this is how it looks. As you can see, the entire mid portion of the stomach here is all stitched. It has collapsed. Now you only have a small portion here through the channel through which the food actually goes. So what to expect? On average, the weight loss that we see is around 17 to 20%. The upper limit is determined by you. It depends on how active you are, how much you want to push yourself. Then this upper limit can be as high as you want, but that is determined by your commitment to the program, how and why you want to lose weight in the first part. Then that keeps you motivated to reach, to achieve your goal. Second is in terms of how long is the procedure time. In most instances, you come in the morning, under anesthesia, we do this procedure, it's around 45 minutes to 60 minutes. After that, you recover. The nurses will take care of you in the post-operative area. Then you go to the ward, we observe you for 24 hours. Next morning, you're home with your family. So you don't have to stay in hospital for a long duration of time. And adverse event rate is very, very low. So what to expect after I do this procedure? On the day of procedure, you're going to have pain and discomfort, which will be treated with medications. By second day, the intensity of discomfort all decreases. By third day, you're up and running. You're not going to have a lot of vomiting symptoms, pain, reflux, none of this persists. It's only during the first 24 hours. And what we see is the weight loss, as previous speakers have mentioned. The most important thing is weight loss. How you achieve it doesn't matter. As long as you achieve that weight loss, you're going to see improvement in all these comorbidities. And I'm very glad to see that some of the faces here who have gone through this procedure are here and then shared their life journey, which was rewarding to know that they have had immense improvement in all their medical comorbidities, and some have even picked up dancing at the age of 50, which is appreciable. Thank you. And so finally, who is suitable for bariatric endoscopy? Anybody whose BMI is more than 27.5, we must know that in Asians, at this BMI, we are at high risk of developing medical comorbidities, and in Singapore alone, there are 1.7 million individuals who are at risk of developing medical comorbidities. So the first option is those whose BMI more than 27.5. The second group is those who are not willing and keen to go for bariatric surgery. They can consider these minimally invasive reversible endoscopic options, which can help you achieve your weight loss results. Now we are fortunate enough in SGH, we have a big team, we have a big group of specialists interested in obesity who can help to tailor the treatment based on your needs so that you can achieve your goals. With that, I thank you again for giving me this opportunity.
So thank you, Dr. Ravi. Next is our most popular segment, the patient experience sharing. So let's take a moment to watch some of the videos of 3 of our patients, and we are also fortunate to have 2 of them here today.
Yes, I'm doing import and export, doing warehouse and forklift and carrying heavy stuff also. My hobbies are I like to eat and go shopping a lot.
My name is Darpi. I'm right now doing a data entry. Past 5 years. I came to Singapore 15 years before. I married Rajesh and I came here.
Before the surgery, I was like 144 kilogram, which is not supposed to be at this age at 44.
We both are obese, so I can't get conceived easily. So I went to see doctor because I have irregular periods. They give me medications and everything, but still my periods was not so good enough to conceive.
I want to have my own kids, which I see a lot of people having, so I do not want to be left alone in future to come in old age.
I have family history in my mother's side. My mother has the diabetes. So that's the thing make me step also that, okay, why not? We also try. I also tried because I don't want to go to diabetes, because diabetes also kill your organ inside hidingly, which you are not aware about it.
The first 5 weeks or 6 weeks, you feel a bit weak. You cannot eat that much. Then you are limited to certain food, that kind of thing. That's where you can feel like want to vomit, that kind of thing. But it's normal. After the 7th week, where you can start to eat everything, but you got to be careful. Because suddenly you get to eat what you are used to eat. The body system cannot take it. So you got to eat a bit by a bit. After the 7th week is 8 week, 9 week or what is it, will be okay lah.
Just recently we had the doctor appointment. So what happened, I have to queue up for the medications. After that he told me, come, we will meet to the canteen. I said okay. Then he said, okay, you go and buy, because we go together. He has to find the place and I have to go for buy some chendol. So he said, okay, I go and find place. Then he said, I'm going and find place here, this side, this side. I said, okay. So I bring the chendol, I buy, I bring. I was looking like this. Where he sit down? I really cannot find him. Then after that, I just walk. Oh, you sit down here. I never recognize you, I say. Last time I can find you very easily. Now I cannot find you where you sit down. After surgery, my diabetes was resolved already. I don't have at all diabetes. So right now, doctor quite happy with it. I have the heart, the breathing issue. When I walk longer, I have breathing issue. I have to wait for a while and this, but now I can walk very easily. Last time I used to go office, my office is nearby. I go by bus only. Right now I can go by walk and come back by walk. After my weight loss surgery, I really had some good adventures. Last time certain exercise in aquarobics, like I cannot able to reach my toe, cannot able to jump, cannot able to stretch, nothing. But right now I can do skipping also, even though that easily I can do skipping with the noodles, which is very difficult to do it. I don't know how to swim, but right now I can float easily without scared. Last time like I panicked, but now I won't panic at all. I feel that confidence in my life that nothing happened to me. So that part is really amazing for us.
Certain things that I do last time took me about 20 minutes to 30 minutes. Now I can do it within 50 minutes or maybe 10 minutes or something. That which is much make me more happy. And mentality is that I can do everything right now, which last time I was thinking of fat, later do, lazy to do that kind. So now I can do everything easily.
When you are fat now, your body and your mind already different way works. You feel depressed, you feel like nobody come and take care of us. But now we are like a lightweight, so we feel, oh, we can take care of ourselves. So now we are so enthusiastic really that whatever we want to do, we really go and do it. No need to scared about this surgery because this is a life-changing opportunity.
My name is Jenny. So actually now what I'm currently working as is a salesperson for medical devices to most of the hospitals. Previously, my weight was about 85 kg and now I have lost to 69 kg. Before the ops, right, I did try to lose some weight by running and going for a badminton session. But to be honest, I hate running. So I don't have any motivation to continue to exercise because, yeah, it's okay lah, don't run lor, then never mind, I got badminton session. But at the end, actually, I didn't lose weight, but I gained weight. So I'm a PCOS patient, means there is some ovarian cysts on the uterus. So most of the month when we girls come, we do crave for very sweet stuff. So even running and going for a badminton session, it doesn't help. There is one incident that bring a very huge impact in my life. My gynae ordered the test for me for ultrasound and pap smear. She ran a full blood test for me, a full panel, and then she realized that the liver is having some problem. So I went for a liver scan. That's when the result came back, hit me again, saying that if I'm not gonna treat my liver, 10 years will take away from me. Yeah, so that's when I decided to find those gastro doctors. That's when I see another light that, okay, I'm gonna get safe again. During my consultation with the doctor, right, he did show us the entire procedure of how it's gonna be done. It's by endoscopy. So it's going through your mouth and all the way into your stomach. So no holes are being opened from your stomach, and then you need to recover from any wound. 1 week before the procedure is on liquid diet, full liquid diet, and after the procedure is 1 month liquid diet. So for me, I was quite taken back and I was shocked that so I cannot eat my favorite food and snacks and stuff. Then he says something that shoot me down. So if you are sitting down here means that you are having a problem. So if you continue with this lifestyle, how are you gonna recover from it? Yeah, so if you don't do it, then that's up to you because it's your life at the end of the day. Then I was thinking, yeah, actually he's right that I should do something to improve my diet and stuff already. After the procedure, when I'm on 1 month liquid diet, what my family and my husband did was everyone will stop eating in front of me. So yeah, so they were like, okay, we have dinner, but they will have dinner outside, and then you can just stay at home and undergo the liquid diet. Yeah. So and then because during that 1 month, I need to start exercising also. It's the prime period for me to faster lose weight also. I changed my eating habits. I stopped snacking. I stopped my sweets and my chocolates, and then we stopped having supper. Yeah, and then we have our meals, breakfast, lunch, dinner on time, but it's not those crazy eating that kind. So it's small portion, make sure you are full, then don't eat already. Yeah, then between times like tea breaks and stuff, we don't eat anything. During my most difficult period, right, my husband had motivated me. So what he did was, the next day after we discharged from the hospital, we went to board the bikes. And then we start cycling from our house and stuff. So, you know, when you are on liquid diet, you don't have much energy. You don't really want to do it. You just, can we just go home? We don't do it already. And then he's saying, so you are telling me you want to stop at this period when you're already halfway there. Just do a little bit more, just push a little bit more. You are not doing it alone, but there is someone here doing it together with you. That's when I really think, okay, just go. The biggest achievement after weight loss, I felt, is that I can dress normally. Like, I don't need to go those plus size shops to really get nice clothes and stuff. I can just go online shopping and just get clothes. Now, actually, I can eat anything, but I think after 1 year plus of the changes, those very oily food, right? When I really take a lot, right, I will really not comfortable and I feel very oily. Yeah, because when you take clear food and those very healthy food for very long, right, when you eat something very oily, right, you will feel that the oil is coming out from your face and then everywhere. Then you're very gao, that kind of thing. Yeah, so you cannot do it. Yeah, then if I tell myself, if I really eat that oily food, right, I means I need to cycle more. Yeah, cannot. That's a no. So yeah, so I still remain the same. So my advice for the people that are undergoing the weight loss and this procedure is to read some information on the procedure so that you are mentally prepared for the entire journey.
My name is Melissa Xavier. I'm actually an early childhood educator working as a center principal and also a counselor working with the Youth Development Center.
My name is Teng Sui. I work in hospital administration.
My name is Hafida Zainal and I'm working as a nurse in a hospital.
Previously, I was obese. My weight ranged around 96 to 98.
I think the highest I was ever was about 121 kilograms.
Back then, my weight was 114.
I tried all kind of medications, slimming tea and all this, but it doesn't work. And in fact, I feel more hungry and I tend to snack a lot.
That period of time when I was in NS, in BMT, I actually got my weight down to about 88. When you are posted out of BMT, you don't have that someone to keep pushing you from behind. So gradually, I just got started to gain back the weight, and once you start, you cannot stop.
I did try to do some brisk walking, but because of the weight I have, it's a bit challenging for me, especially climbing up the stairs.
There was not any accidents or incidents that really occurred because of my weight issue. It was actually more, I would say, chronic. High blood pressure, migraines, snoring at night, which was, I think, particularly bad because I had to go for a sleep apnea test and they did diagnose me with sleep apnea.
I was diagnosed with breast cancer in 2017. After I finished my treatment, one of the doctor, the oncologist, advised me saying that it's better for me to lose weight because of my weight that I have cancer. So they referred me to this center where I get the full support from the doctors and the nurses there.
At first, yeah, I was a bit hesitant to go through because I love to eat. I tell myself, I don't want to go, but then my husband is the one who's really supporting me and tell me, I think you better go because, you know, there's a lot of benefits. And moreover, my blood pressure is keep on going up.
The turning point, or rather the point in time that made me realize that I should really seek treatment was when my doctor pointed out to me that the migraines were due to my sleep apnea issue, which was also due to my obesity issue, and I had been prescribed increasing strength of painkillers because I was gradually getting immune to the weaker ones. So that was when I really decided to say that I will go and see a specialist.
My husband, of course, he's the one who researched on this bariatric orb and all this. So he told me it's really safe to go through and you really have to sacrifice your food. And he was all the way with me. My late father-in-law, in fact, father-in-law passed away 2 years ago, strongly encouraged that the family members at home don't eat any of my favorite food and to go through whatever food that I'm eating.
I would say my biggest supporters were definitely my parents. They were very highly supportive of my decision, even though it meant going for a complex and major elective operation.
The support that I have is my friend. She supported me by giving me some talks and what are the menu that I should have taken to eat and what not to eat.
After the surgery, my lifestyle has improved tremendously. I'm able to jog, I'm able to walk long distance, I'm able to climb up the overhead bridge, and yeah, I jog 2 times a day, 5+ in the morning and in the evening after my dinner.
I would say emotionally, it's definitely increased my confidence. Back then, I really hated seeing myself in photos. That level of self-loathe was there.
Since I went for the surgery, I feel that my life is better, where I can go cycling, I can go even traveling. Even though if it's like working as well, I can be able to run faster to the patient, without having a leg pain. I'm so satisfied with the result that I have.
I will slowly encourage the family members of the patient who is about to go through this bariatric op or who has the intention to go through this bariatric op, especially after the surgery, to be with them there, to talk to them and ask them how you feel today, well, what else I can do for you. Bring them for a walk because or else it will affect them mentally. So to avoid all that, talk to them every day, how you feel, would you like to have a drink with me, sit with them, share the drink with them. That will give them the utmost support. That is how my family actually supported me.
Okay, what inspiring and motivational experiences from them. Today, we are honored to have Ms. Darpi and Ms. Melissa, who have walked this journey with SGH Obesity Centre. Ms. Darpi has a laparoscopic sleeve gastrectomy earlier this March and is about 8 months since her surgery, while Ms. Melissa had a laparoscopic sleeve gastrectomy in the March 2019 and it has been 3 years and 8 months since her surgery. Let's warmly welcome them on stage as well as the rest of our speakers on stage for the Q&A session. For the Q&A session, it's the same as just now. You can scan the QR code on the chairs in front of you or online on the link. Or if anyone have a questions in the audience, to just raise your hand and the microphone will come to you. So we have a microphone pass to the gentleman there.
Thank you for your sharing, doctors. This question I want to ask earlier on, but I didn't get a chance. I think to the doctors. You mentioned earlier on that these surgeries may be able to claim from insurance, what is the maybe? What scenario we cannot claim?
It's a good question. It's also not being solved yet at the moment because some insurance companies are able to claim, some do not. I think it's because there are different levels as well. And sometimes we do have the right appeal to the insurance companies, and some able to go through and some are denied. So I'm unable to say exactly. That's why.
Thank you, I understand. The next question I want to ask is that it was mentioned earlier that I'm diabetic. The question is, I'll stand up and show you. Do I need any of these surgeries? And if I do go for it, can I stop my diabetic medications? Thank you.
Good question. Maybe endocrine.
Sure. Yeah, thanks for the question. So I think there's no doubt that diabetes and obesity, they are like Siamese twins. They come very closely together. They are very good friends, okay? So if you gain weight, the diabetes is going to get worse. If you lose weight, the diabetes is going to get better. And whatever the method of weight loss, you know, the diabetes improves. So I'll give you an example. There was a recent study on very low calorie diet. So this is something that we didn't really touch on today. I mean, there's a lot of other interventions out there for obesity. After very low calorie diets with successful weight loss, the diabetes can go away. This is without any procedure whatsoever. Then I think Dr. Sarah mentioned about weight loss medication. So we've got GLP-1 agonists. So these are hormones that go up after bariatric surgery. So what the scientists have done is they find out what are the hormones that changes after surgery, and they distill it into a pen, a medication that needs to be injected. So that also reduces blood sugar, and with successful weight loss via that method, the diabetes also improves. And bariatric surgery, from our own data, I think we've got over 1,000 patients who had surgery in SGH. We found that about 50% of our patients with diabetes can actually go into remission. What that means is the diabetes can go away, okay, without the need for taking any diabetes medication. So that's a very powerful result. And I have no doubt with the sleeve gastroplasty that Dr. Rabi mentioned, there's also going to be some patients that diabetes can resolve and go away completely. Now, which patients with diabetes can actually achieve that kind of outcome? We look at a few parameters. So how long has the diabetes been? So if somebody's just recently been diagnosed with diabetes, you know, it's not as severe, then the chances of going into remission is a lot higher. Okay, whereas someone has diabetes for 20, 30 years, they're on a very high dose of insulin, they may not be able to come off all their diabetes medications, but yet diabetes will improve, okay? 97% of our patients with diabetes have improvement, okay? So if those are on insulin, they may be able to come off insulin or go from 3 or 4 injections to just 1 injection after surgery. So it's a very good question because a lot of people come to seek help with us, not just for the weight, but for their diabetes. Any other questions on the floor? Just like to thank our two patients who so bravely come to share. I think the videos, I'm not sure what you all thought of it, but I thought it was really powerful messages, and then I really enjoyed hearing, you know, from the patient's perspective, because from doctors, from our allied health professionals, we can say one thing and we can give you the facts, we can give you the information, but I think hearing right from the patient how they've experienced it, what were the challenges, you know, what were the benefits that they achieve and how they managed to achieve it. I think that's really, really powerful. So I really encourage you all to ask our patients, you know, any questions, or Melissa, Dapi, if there's anything you'd like to share at this point, you know, to our participants.
Test. Yeah, I would like to firstly thank Dr. Eugene and his team, the Bariatric team, for my results from where I am previously and now. And yeah, the first consultation with Dr. Eugene, I actually ran away. I told him, no, I don't want to do it. Because I built relationship with food. I love to eat. Especially biryani, satay, you tell me. I go for it. Chicken rice, yes. Always I need rice, you know. At all my 3 meals, I will feed on rice. Without rice, I think I will die. So The second time when my hubby actually brought me to the orthopedic to see the orthopedic because of my knee pain, and then actually the orthopedic told me, actually your knee, there's no problem, no. The problem is the top. Your weight is the problem, it's not your knee. So don't go for knee surgery. You manage your weight. So immediately he actually referred me to Life Clinic where Dr. Eugene was there. Angelina, the nurse Angelina was there. Okay. So these are the people who actually talked to me. And this time, my hubby straight away tell Dr. Eugene, okay, go for it. She will go for it. Then I tell myself, go for it. Okay lah, go for it. So I really make the brave move. I said, okay, this time I want to go for it. Why? Because I have a very young girl, and she's my only daughter. I married quite late. So I got my daughter quite late. So I want to live for her. I want to live for my hubby. So I want to live for my family. It's not that I want to lose weight to look good, to go for modeling. No, I want to live long. And when I go through the journey of losing the weight, right, I really appreciate, and I put a lot of effort. I could say that I'm really proud to sit here in front of all of you to prove my results. Yeah, so thank you so much to the Biotic team. Thank you.
Okay, we'll take some questions from the online. So the first one is to Ms. Tan. When can a patient resume normal diet after bariatric surgery?
Okay, so after bariatric surgery, there are 4 stages of diet. So we'll start with this clear liquid. We start with water, and eventually we'll proceed to a full liquid diet. So for 2 weeks, and eventually stage 3 diet, patients can start to have like pureed or soft diet, but focus will be on protein, followed by vegetables and fruits, and eventually stage 4 diet would be the normal diet. So the progress-wise depends on individual, but for a person to reach stage 4, so it would be around roughly around 2 months. Yeah.
All right, thank you. So the next question is to Dr. Sarah. Does weight loss medication affect other medication, as I'm currently taking medications such as gabapentin, allopurinol, and telmisartan?
Okay, thanks for the question. So the weight loss medications that I mentioned earlier do not affect the absorption of other medications, and they do not interact with other medications. But of course, it's also important that you get evaluated by your doctor as well. I mean, the other question is, what are your underlying medical conditions that lead you to be on these medications? For example, if someone has uncontrolled high blood pressure or heart problems, then they would not be suitable to be on certain weight loss medications. Thank you.
All right. So the next question is to Dr. Ravi. So is the sleeve gastroplasty reversible? After stitching for a few years, what happens to the stomach cells? Do the stitches last lifelong, and the chances of the stitches becoming loose and loses its effectiveness?
Okay, thank you. Hello. Yeah, thank you for the question. Can we shine it again? There are like 4 different questions in that. Okay, so the first part is sleeve gastroplasty reversible? Yes, the procedure is reversible. Let's say within 3-4 months you say, I want my stomach back, can you like remove all the stitches? Of course we can do that, but again the question is why you wanted to go for this procedure in the first part, right? So that is the first question we need to answer. If you want the stitches to be out, yes, we can do that, but that's not advisable. That's against the primary purpose of doing this procedure. And the second part is what happens to stomach cells. As I said, this procedure does not involve cutting your stomach. All your stomach cells are with you. They are healthy, they are the same, they function the same way. So though we don't do anything to your stomach cells, we don't burn them, so they are all intact, they function normally. Do stitches last lifelong? There is nothing called lifelong in medicine so far, so these stitches are not meant to be lifelong. As these procedures are reversible procedures, there is a certain durability to it. It's not like lifelong. In some patients, what happens is with time, your stomach tends to fuse, and then they maintain a narrow lumen. But in some, the stitches go off. The extent to which, the rapidity to which these stitches stay or go off depends on how you maintain it. Again, if you follow all the instructions that we give post-procedures, you're going to have it for a longer duration of time. let's say you do this procedure, second month you wanted to have Big Mac, or you want to test how effective the sutures, you go and like eat a big size, American size breakfast or meal, then of course that's not ideal. So in ideal circumstances, the stitches can last longer. In situations where we put these stitches to test, like how they test all the cars, they are accident proof or not, then basically you are going to see adverse effects. Yeah, the stitches may go off if you don't follow the instructions. Yeah, I think that's about it.
Thank you for the answer. All right, so the next question is to Dr. Eugene. So what are the risks of sleeve gastrectomy? Leakage risks, any risk of cancer in the future as well, and will the stomach actually grow back? Yeah.
Yeah, thank you for the question. So the main drawback actually of this bariatric surgery versus all the others treatment is that there are surgical risks, and usually they're divided into the general anesthetic risk versus the actual surgical risk. So we're talking about the actual surgical risk of the sleeve. We are dividing the stomach, and we have to operate on some of the blood vessels. So bleeding is one, and the other major complication is leak immediately after surgery or a few days. So, but thankfully these are very uncommon. They are usually quoted as about 1% plus or minus 2%. Okay, so anything in medicine, when they quote less than 1%, is usually quite rare. So the other question is
How long can the sleeve last?
How leakage risk, right? So any risk of cancer? Maybe I'll go in order. So any risk of cancer, when we do sleeve, there is a concern of if you have this condition where you predispose yourself to cancers of near the esophagus, okay, and it's called Barrett's esophagus. In this instance, it's associated with reflux risk, but the actual number is not yet known. And the trouble is that with obesity, there's also a baseline risk of cancer, and normal people also have a normal baseline risk of cancer. What we do know, of course, is that bariatric surgery actually decreases your risk of cancer, especially endometrial, and just now we mentioned breast, and a few others. So, and then it also prolongs life. So there is actually greater benefit than this risk of esophageal cancers, which has been of a concern, of course, and still we are trying to find more research for that. And how long can a sleeve last? We have studies up to 10 to 15 years to show that it's durable. Certainly some weight regain is expected, but if you follow the lifestyle modification, it should be maintained. And whether it can grow back, the stomach doesn't grow back, but because it's a muscular organ, it can be stretched. So if overeating, especially after a few years, you may feel the restriction getting less, it is possible. That, and also if the sleeve is not very tight to begin with, if the surgeon has made not so tight a sleeve, then certainly there may be some distension of that pouch.
Thank you, Dr. Lim. All right, so there's a lot of questions on the sleeve gastrectomy. Ms. Dapi just did her surgery about 8 months ago. Do you have anything to share regarding the surgery and all?
Hi, everyone. Hello. Hello, everyone. I'm going through this surgery basically as per they mention is 8 months, but basically in our mind is 10 years since the surgery was discovered. So from that time we are thinking for this, but my husband was not ready to do any surgery because he is overweight also. His weight was 144 and my overweight is maximum is 125. Right now his weight is 72, exactly 50% after his surgery on 2021. And my weight right now is 82 or 83 kgs. After 125 to 83 is quite good and healthy also, I can say. So this is not like a surgery for your risk. It's a surgery for the living the life. when we be born, we already bring the risk already in our life. So why we want to scare from the any surgery or any medication, side effects and this and that? Just take the risk in the life and just go ahead with the flow. This is only our motivation to with each other, because end of the day nobody come and help us to live the life. We own self have to live our own life. People can give you the helper or nurse or anything, but nobody will give you the time. So what is important in the life is the most important is the time with each other and healthy living life with each other. Because like you give the time to people, but the person cannot able to walk with you, talk with you, live with you, then that is already depressing life you are living about. So for us, it's like we both are really encourage each other. So when he start his journey, I also start my own journey. So we both complement each other. When he's going for liquid diet, I also follow his diet. When I'm going for the diet, he follow my diet until now. So that's the reason he achieved his weight loss is until 50% loss, which is really, really recommended surgery for me, I can say. And really we can do many things nowadays. Last time we cannot do many other things which we scared or people don't allow us anything. Now we can go for any adventure trips, any adventure rides, anything we can go ahead. So like this is like really, really, really life-changing experience for us. And we feeling like our lifestyle is really changed us a lot. Like right now, inflation, so right now we are already struggling from so many things. But now we can say our food cost is very low already. So that is the best way already. What was last time I was used to spend money, same money I'm spending right now. Or maybe lesser, I can say. So that way is a very cost-cutting surgery, I can say, for us. So healthy and basically healthy also together ready, and your cost cutting, you can live in the same expenses and you can enjoy more than that. So that's my best experience which I can share with all of you.
Thank you for your experience. Let's go back to the next question. So this question is for Dr. Lee. I am diagnosed with NALF, which is non-fatty liver, non-alcoholic fatty liver, and a BMI of less than 27. What can I expect when I attend the clinic?
Okay, so thanks for the question. So fatty liver, non-alcoholic fatty liver disease is extremely prevalent. In fact, it's more prevalent than even diabetes or obesity. I think a local study has estimated that up to 25% of the population actually has fatty liver. So when we look at fatty liver, there's an entire spectrum of it, okay? First, the fat accumulates in the liver because there's no safe place to store fat, okay? We normally store our fat in our subcutaneous areas, so love handles, you know, there's and our thighs, our arms, etc. But when all these places are filled up, we start to store them in vital organs, places where it shouldn't be. So our liver, our pancreas, even our heart. Okay, and when you get steatosis, that's fatty liver. Over a period of time, the liver gets irritated. Okay, why is this fat doing in my liver? It shouldn't be here. Then it gets inflamed. At this point, it's called steatohepatitis. Okay, and again, after another period of time, after the inflammation happens for a prolonged period, you end up with hardening and scarring of the liver. So that would be fibrosis, cirrhosis, okay? And that really is a serious medical problem, and in some patients, it can also lead to liver cancer, hepatocellular carcinoma. Okay, so when you say you're diagnosed with fatty liver, we need to know at what stage this is, and sometimes the ultrasound can show features of hardening of the liver. There are other scans that can better characterize the liver, such as the fibro scan, that can look at the hardening of the liver. If there's inflammation, sometimes the blood test can detect elevation, so increase in our liver enzymes, okay, to suggest maybe there's some inflammation. So the question on what can we do about it? Well, as we know, obesity is associated with all these medical problems. Fatty liver is one of them. So the solution is weight loss, okay. As Dr. Sarah has mentioned, 5-10% weight loss is clinically significant, and it will be sufficient to improve the fatty liver. So I think the first thing to do is to look at your diet, look at exercise. Is there any way you can improve that? you know, all the talks we had earlier, you know, behavioral strategies on improving lifestyle. So I think at this point, I just also want to emphasize that our public forum is to increase awareness, okay, obesity, and really motivate and spur action, okay, things that you can do at home in the community, you know, to improve your health. Okay, we don't necessarily want to channel everyone over to our center. I think the prevalence rate is too high. We won't be able to see everyone here or everyone that needs help. So the government recognizes this. There's Healthier SG initiatives coming out. You have seen it in the papers. There will be community programs out there, Active SG to have exercise programs. The Health Promotion Board has got a lot of dietary tips and things like that. So really look hard at your lifestyle, work on it. And then after that, if you lost weight, great. If you've tried really hard and you can't, we talked about, you know, the physiology, why is it so difficult? And lifestyle alone is not sufficient for some. Then, now you know that there are other options, medications, there are sleeve gastroplasties, bariatric surgery. These are all very effective options that are available.
All right, thank you. So the next question is to probably Irene. The overweight person does not have a good technique or does not do 30 laps a session. Will the exercise actually be effective?
Okay, thank you for that question. So I think we are all always very concerned about you know, how long we manage to do a certain exercise, whether we are able to make it as intense as we want it. But in terms of someone with obesity, we are also a little bit more concerned if you have a lot of other problems, other health issues, other joint problems. I would say generally I'm unable to give a very concrete answer because it has to be individualized, especially when it comes to certain risk. But as a very generic guide, if you want to do some cardio exercise, which I assume that's what it's about, if you are new to the activity, start with something that is lighter. So at least something like a moderate intensity, which means your heart does pump a bit faster, you get a little breathless. And something we like to use is the talk test, meaning that if you have someone with you, you can sustain a conversation. So you can talk, but you cannot sing. So that might be a more appropriate intensity to start with instead of something that pushes you to the max right at the start. Okay, so if you want to progress further and you have those medical conditions, you're worried about the safety, then I think you will need to consult someone, be it your doctor or your physiotherapist. Thank you.
All right, thank you. So the next question is to our patient, Ms. Darby and Ms. Melissa. After the sleeve gastrectomy surgery, how long does it take for a patient to fully recover, meaning going back to normal food, normal activities?
I have to go first, because you don't want to go first. Okay, for me, there is no such thing as normal diet anymore. I eat moderately. I cannot eat at one go, so I eat small meals. And sometimes I try to eat fast, but I still vomit out, so I have to still go slow with a small portion. And I don't take my favorite food, as what I said. I'm very careful of what I eat. Yeah. Back to normal after the surgery is about, okay, I was in the hospital for 3 days, and I start walking after a week.
So for me, it's just 8 months. So I can say now I am living totally normal lifestyle. But basically, you have to follow really your diet at all. You don't follow your diet, then you will no point to go for this surgery. Basically, so for me, it's like, but still I try all kind of food, but which is a healthy one. So all substitutions I have right now. Like my house, everybody love the oily food, fry food, everything. I found some different ways that okay, oily food, fry food, you can eat it, but I put in air fryer everything. I just put a pinch of the oil and I just do air fryer, so that food also like air fryer food, but it's look like totally fry food. You don't feel it's not a oily food or not fry food. Then that way we are, I search, because my husband loved the food, I love to eat food. So I do all the innovations, all the mix and match recipes. So from there, I innovate many kind of new recipe as a healthy recipe, I can say. So that's the way right now, my and my husband lifestyle is a totally normal lifestyle right now. So we can eat everything, but in the healthy way.
Thank you. So the next question is to Dr. Sarah. Will weight loss help those with hypertension and high cholesterol to be able to get off the medication?
Okay, thanks for the question. It's a great question. So I think like we were mentioning earlier, yes. So the whole point of losing weight is to help with the improvement of these complications of obesity, including high blood pressure, high cholesterol, as well as diabetes, like Dr. Lee mentioned, and the many other complications of obesity. Of course, the amount of weight that is lost, that will affect how much improvement we see in these conditions. So for example, someone who's able to lose more weight will see greater improvement in their blood pressure and in their cholesterol. We would expect patients to either have an improvement or a reduction in their blood pressure and cholesterol medications, even if they're not able to come off the medications completely. Coming off the medications completely, so that depends on many other factors as well. For example, how many medications the patient is on, how severe their condition is, and how much weight they have lost. I think Ms. Melissa also has something to share about this.
Oh, okay. I'm taking high blood pressure medication. I have high cholesterol before I go for this surgery. My cholesterol level was measured at around 6.8 before the surgery. And I did not take cholesterol medication until today because my cholesterol has dropped down to about, the lowest is 2.9. Yeah. High blood medication, before the surgery, I'm taking 60 mg. Now it was prescribed at 2.5, but I took it seldom, maybe about once or twice a week. Depends, because childcare, you know, working with children can be, you know lah, I don't have to say. So the days that I felt that, you know, yeah, my high blood is a bit high, because I will measure my high blood. So if necessary, then I will take 2.5. Because Dr. Lee always tell me, Melissa, I don't need to take any more, just give it away. Yeah, so I'm happy. So you can see the drastic changes in the measurement of the medication from 60 mg to 2.5. Yeah.
I want to say in that also, because I have some experience in my family also. They also went through this kind of surgery. They have some kind of a medical history. Right now, they also not taking any kind of medications after this surgery. Their weight is just 80 plus, but they come to 50 plus weight ready, but no more any medications for them also. So for me also, I can say, who is to take care of our own body? We don't take care of our own body, and we are put our own body to someone else's hand. This is not like a joke. We are giving them to making us the healthy. So please, whoever doctor suggests you that do this one, they are not just coming to like tell you that, oh no, just do it. They just tell you they have to take care of you. That's the reason, because we don't know our own organs inside what's going on in our body. So that's the main thing to go for the surgery or anything, that because we don't take care of our body, then we think our children or anybody come and take care of our own body. Nobody. So this is the reason that we also think, because you see, we go in the older, we have to pay money for the doctor fees and everything. Better you take care of your own body and right now, so that money you pay for your own life and you can live more longer life with a healthily. That's the best way. That's the reason I can say that this is a really, really recommended surgery.
All right, thank you. The next question is to Dr. Eugene and Dr. Ravi. Are balloons used as a temporary measure to bridge towards surgery?
So we have to view balloon in two ways, why we are doing the balloon. In certain group of patients, in certain BMIs, doing the balloon is just therapeutic. You can achieve your weight loss goals. The role of balloon as a bridge comes for patients whose BMI is on the higher side, where the amount of weight loss which the balloon induced may not be sufficient enough for you to realize all your benefits. In those instances, yes, we can use balloon as a bridge. Balloon is not always used as a bridge for surgery in all groups, so it has to be customized and personalized based on patient's conditions, patient's medical issues, patient's weight, BMI, and so on. So it does has a role, both as a treatment option and as a bridge option, especially in those patients whose BMI is slightly on the higher side.
All right. Thank you. So the next question is to Dr. Sarah. So the patient's profile is a 59-year-old, BMI of 25, weigh about 72 kg, has 3 high medications for more than 25 years, hoping to achieve about 7 kg weight loss. So which treatment would you recommend?
Yes. Thanks for the question. So I think it's great that you have made the first step to attend the forum and you have that motivation to want to lose weight. For someone of this profile, I mean, without all the details, I would definitely recommend starting with lifestyle modifications, diet, exercise, all the things that we discussed earlier today. These really form the foundation of weight loss, and they can also help with control of diabetes, high cholesterol, and high blood pressure. And then, of course, for more like specific type of treatment, you can discuss with your doctor who is managing your conditions. There may be specific medication that may be helpful for you as well. Yeah, thank you.
All right. So I think the next question is to Ms. Tan. How effective are meal replacement for weight loss?
Okay, so meal replacement is a tool to help people to control their calorie intake, like what I mentioned earlier. So if you want to lose weight, if you are on this reduced calorie diet, so you want to use meal replacement as part of your meal, like to help you to control calories. So that would help you to control your overall calorie intake. But however, if you take a meal replacement, but later if you feel hungry and you go and have another meal, then this will defeat the purpose of having this meal replacement, and then that wouldn't help with weight loss, with calorie control. So it's really depending on like how you want to use that, and definitely there are many types of meal replacement outside, but some of meal replacement they are low in protein and then high in sugar. Yeah, so those meal replacement, they claim as meal replacement, but the component like protein-wise may not be sufficient. If you are taking those meal replacement, you may not feel full with that, and then eventually you go and take like snacks or that, which is high in calories. So then in that case, it won't help with weight loss. Yeah, so it's really in a nutshell, so the meal replacement is a tool to help you to control calorie intake, but your dietary habits and exercise, all that have to be equally important as well.
Thank you. So the next question is to Dr. Eugene and Dr. Ravi. I had my Roux-en-Y gastric bypass surgery. Can we still do the stapling or endoscopic stitching?
I'll just make a quick mention on that. You can reverse a Roux-en-Y gastric bypass into a sleeve. It's been done, but it's not routinely done. It's very rare that only certain circumstances where the bypass you get very severe hypoglycemia, for example. Very, very uncommon. And I think there's a stitching option.
So you must realize that obesity is like a chronic disease. At some point of time, despite having all these treatments, in a group of patients, we experience weight regain. It can happen at 2 years, it can happen at 5 years, it can happen at 10 years. The weight regain can be mild, sometimes substantial to the amount you're having all your medical comorbidities coming back, being in diabetes coming back and so on. So one such thing, although it's less common with Roux-en-Y bypass, you still can have problems saying that now you can eat more, your portion sizes have gone bigger, you are starting to gain weight and so on. It typically happens around 5 years' time. So in that instances, most of the time you look for options to see whether you can control your appetite and meal volume. So what we can do is, the problem in such instances is your stomach may dilate. The connection between your stomach and small intestines may dilate, making you eat more. So in those group of patients, what we can offer or we can do is we can do an endoscopy, we can do a stitching to reduce the size of the remaining stomach you have, and also make it narrow the connection between your stomach and small intestines. That will help you to go back to your old weight or lose the excess weight that you have gained. The procedure is very simple. It doesn't require you to stay in hospital more than 24 hours. It's similar to other weight loss stitching procedures that we do by endoscopy. And on average, you lose around 10 to 15% weight loss. The same applies for those patients who regain their weight. Let's say you go for sleeve gastrectomy and then down 2 or 4 years later you experience some weight regain and you want to consider revision options. Again, we can try endoscopic methods to help you. So it's possible.
All right, thank you. So the next question is to Ms. Serene and Dr. Lee. For the pre and post sleeve gastrectomy surgery, during the liquid diet, can I take my usual mental disorder medication?
In general, for those with a psychiatric disorder, we actually advise you to continue to take a medication to actually attain a stability in the condition prior to the surgery, and definitely to continue post-surgery. And if you have actually therapy to go, it's also good to continue to see the person in therapy to work throughout certain issues, because during the liquid diet, some of the patients with depression or anxiety could actually feel like the conditions worsen because eating could be a coping actually for our self-soothing, and when that mechanism is actually taken away, then we feel quite lost and we don't have other ways to cope with our emotions. So medication and also other modifications actually quite important to sustain throughout. Anything to add?
Yeah, no, I totally agree with Serene. So for I think we have heard the success stories, but I think underlying that there's a lot of also advice on how important family support is, because it's actually not easy to pull through, especially the initial stages. So for our patients with mental disorders, we really want to make sure, as Serene mentioned, the mood has to be stable. I would want the patient to be seen by our psychiatrist. Any medication should be adjusted and optimized, because some of these medications, their levels can change after bariatric surgery, especially after gastric bypass. Okay, the drug levels in the blood can change. So a psychiatrist needs to be aware, and they need to adjust those medications. And then our psychologist will also assess the patient, make sure that they're coping okay, everything's stable before going through this operation.
All right, thank you. So the next question is there an age limit to go for any of the above procedures, especially for overweight children?
Well, I'll talk about the bariatric surgery first. The latest guidelines that came do not specify any particular age limit, but operating on children is of course very sensitive and also and controversial. So what we do know is that you don't really need to have the full skeletal maturity. So that would be in a region of maybe 13, 15 years old. But we don't do many of these operations, and we need to have the pediatric doctors to give some guidance, and usually it's a shared decision.
Yeah, I mean, children who are overweight and who have obesity, certainly this is really an important condition, and if they are overweight when they are so young, by the time they grow up, I think they'll have a lifetime of chronic illnesses to suffer through. So it's very important that if you have any friends, family members, children who are young, really they need to seek help. I think lifestyle is even more fundamental, because for children, a healthy diet, exercise will help them grow. And as Dr. Lim mentioned, we also have to balance the growth of the child. So they may not need full skeletal maturity, but we also have to make sure that if they're undergoing puberty, they are growing appropriately, and they have enough of the healthy diet, nutrition to support them through this growth. The other option is with weight loss medications. Earlier there was mentioned there are a number of medications. Recently, one of the medications, liraglutide Saxenda, that has been studied in adolescents age of 12 to 18. Okay, and in this trial, they found that the drug is very safe for these children, and then also effective. So that's another option that is available in terms of medications. Because with children, we're always a little bit more concerned, right? We want to make sure that everything is really safe for their age, for their growing, before we advise them on any of these options.
I think it is very true, because what we see is a child who is obese, the likelihood, if we take 10 children who are obese, we see 7 of them progress to become obese in their adulthood. So it is very important for us to address this behavior or diet change very early on in their life. Especially, I mean, sometimes what we do is, as parents, to just make them have their own time. We give them sweets, candies, ice creams and everything. And with pandemic, the activity has gone down significantly, even in Singapore, and that has been published. So it is important from the family perspective to inculcate good behaviors. However, sometimes we may need to seek help, as like with surgical procedures, even endoscopic procedures. When we plan, we want to make sure that we employ all other measures before we consider these procedures in adolescents. The youngest ones which we have done so far is around 17 years old, and they managed to reach their goal weight. But again, all these procedures, before we want to consider, we want to ensure that the family support is good. We have tried and tested other options. If none works, then we go on to this.
All right, thank you. So to Dr. Lee, how do we get referred to the obesity center with or without a referral letter? Is there any difference in the terms of cost of treatment for the obesity center?
Happy to see this question. I hope that means that you found this session quite useful. So yeah, this is a very practical point, right? How do you actually get referred over to our center? So there's 3 ways. You can make a self-referral. Actually, later on there'll be some information on how you can do that on our SGH website. You can get a referral from your GP, from a family doctor, or you can get referral from polyclinic. Okay, so those are the 3 ways you can get referred. And just a point to note, whether on subsidy status, if your referrals from polyclinic or actually from any restructured hospital outpatient clinic, they can also refer. Then that would then the payment class will be subsidized. If you make a self-referral or if you get a referral from a private GP, then that would be under a private rate.
All right. So thank you. So due to time constraints, we are unable to answer all the questions that you asked, but fret not, we will try to answer the questions on Slido, which you have put up on, and we can have access to it for the next 24 hours. We've come to the end of the forum. Thank you so much for the speakers on stage to give all these answers. We'll get Dr. Lee Zhenting to close the public forum.
All right, thank you everyone. So after 2.5 years of COVID, we can finally meet up in person this time around for our public forum. So the last one done was in 2019. So I hope everyone will leave the forum today more informed on the how-to and the importance for weight management. So once again, I would like to thank the organizing team and our speakers today, and also a big thank you to the various sponsoring companies for their support. And of course, last and most important of all your support today for coming today to make this forum a big success. All right, thank you everyone. Thanks.
So thank you everybody, thank you Dr. Lee. We would like to thank you for all your time this morning to be here. So there will be a QR code on the flash screen to just fill up the feedback form before you leave for lunch. Kindly leave on the right hand side of the door to collect your lunch and also your goodie bag. So thank you and have a great day ahead. Oh, right side.